What if your struggle with depression, anxiety, or insomnia is because you lack magnesium? Let's discuss how magnesium could be the missing piece to your mental wellness. At the end of the video, I'll also talk about the different formulations of magnesium and which one you should take. Do you know that over 40 million Americans are dealing with mental health issues? This is more than the populations of New York and Florida combined. Mental illness is complex. Medications and counseling work and can be great, but what if you've tried all the options available but still struggle? What if you struggle because you lack some essential micronutrients to help you function optimally, like magnesium, for example? Some studies show that a deficiency of magnesium can contribute to depression, anxiety, and sleep difficulties. Magnesium is the fourth most common mineral in the body. It is vital for over 300 biochemical reactions, including muscle and nerve function. It also helps with blood glucose control and blood pressure regulation. What this means is that if you're deficient in magnesium, this could adversely affect you, not just physically, but also mentally. So what if by simply replacing your deficient micronutrients, you see an improvement in your mental health? Now, don't get me wrong. I'm not advocating you stop taking your medications. Rather, I'm saying you optimize your mental health by ensuring you're not deficient in micronutrients like magnesium. A few years ago, I had a patient who was struggling with anxiety and depression. She was on several medications but continued to struggle. I introduced some lifestyle interventions to her treatment. I also requested a micronutrient panel which revealed that she was deficient in magnesium. A few months later, she was doing much better with the lifestyle treatment and her magnesium level normalized with diet and supplements. Unfortunately, magnesium deficiency is more common than you think. One reason for this is soil depletion. Intensive agricultural practices rob the soil of this essential mineral. This makes many food crops such as whole grains low in magnesium. When foods are processed, magnesium is stripped, leading to deficient levels of this mineral. Some refined grains may contain less than 20% of the magnesium of whole grains. So eat whole grains. Some medications, alcohol, and caffeine also reduce magnesium in the body. Stress has become a constant in our current environment. Studies show emotional and physical stress can drain the body of magnesium. The stress hormone cortisol is known to be higher when magnesium levels are low. In 1900, the average intake of magnesium was about 500 milligrams daily. Today, it is less than half this amount. The daily recommended dietary allowance RDA for magnesium is 420 milligrams for men and 320 milligrams for women. Magnesium helps with transmitting nerve signals within the brain, and some studies have shown that magnesium levels are low in several mental disorders, especially depression. Magnesium is an NMDA receptor blocker. It is the same target of the fast-acting antidepressants Spravato or esketamine. Blocking NMDA increases a brain chemical called brain-derived neurotrophic factor, BDNF. BDNF is like fertilizer for the brain. It helps with a process called neuroplasticity, a process that improves nerve connections by destroying damaged nerves and growing new ones. Magnesium interacts with GABA receptors in the brain, supporting the calming actions of this chemical. Magnesium also maintains healthy limits of glutamate, a brain chemical that can cause excitation. People with higher magnesium levels also have healthy amounts of serotonin, a brain chemical involved in depression and anxiety. Dopamine is another compound that requires magnesium to synthesize. As you can see, the body needs magnesium to create a lot of essential brain transmitters that ensure mental wellness. Magnesium affects the hypothalamic pituitary adrenal axis, thus controlling the levels of ACTH and cortisol. A dysfunction in this axis can contribute to depression, irritability, poor concentration, difficulty sleeping, and anxiety. Researchers have found an association between very low magnesium intake and depression. Another study also showed that people with the lowest intake of magnesium were 81% more likely to be depressed than those with the highest intake. Eating foods rich in this micronutrient is the best way to get your magnesium. Magnesium-rich foods include pumpkin seeds, spinach, almonds, bananas, black beans, avocados, tofu, and quinoa. Magnesium comes in different forms to help you supplement your diet. Magnesium glycinate is a very well absorbed form. It is different from the other forms like magnesium oxide, which is not well absorbed and can cause diarrhea. Magnesium sulfate, magnesium carbonate, and magnesium hydroxide are all poorly absorbed. Magnesium citrate is one of the most common forms of magnesium with reasonably good absorption but can also cause diarrhea. Magnesium L-threonate has been shown to readily cross into the brain, and animal studies show that it supports short and long-term memory, learning ability, and brain function. Amongst all the formulations, magnesium glycinate is the best absorbed. Supplementing with vitamins D3 and B6 helps with absorption even more. Magnesium glycinate can also be taken on an empty stomach or with food. You also don't need strong stomach acid to absorb it, which is different from many minerals. This means even as you get older, you can absorb it just as well. Note that magnesium glycinate and magnesium bisglycinate are essentially the same thing. Watch this next video to find out 3 essential micronutrients your body needs to ensure mental fitness.